Julia was a super healthy kid right from the get-go. She was just a strong, happy baby. It was right around 6 months that we noticed odd movements at bath time, but kids are so squirmy at that age, we didn't know what to make of it. We didn't realize it at the time, but those were her first seizures.
When Julia was 9 months old, we took her to the emergency room for the first time. She started jerking uncontrollably in the bathtub, and it wouldn't stop. It took the doctors over an hour to get that particular seizure under control.
Fortunately, we got a Dravet diagnosis early. When the standard epilepsy medications weren't working, we were transferred to our hospital's head epileptologist, and just by coincidence, he had studied under Charlotte Dravet. He started talking to us about genetic testing for the SCN1A mutation, which we were able to get. And by 15 months, Julia was diagnosed with Dravet syndrome.
Before her diagnosis, Julia had close to 40 seizures in a year. It was almost weekly, and it was very stressful. It was like we were tethered to the emergency room.
We just felt like we couldn't do anything or make any plans. I mean, every time I would get to my office, I'd have to turn around and come home. It was very, very alienating. We had actually made some great friends in our birthing class, and we had all these plans to get together as our kids grew up, but with Julia's frequent, intense seizures, we just couldn't participate. It was hard for her to do stuff and just be a normal kid. And it was difficult for us to watch everybody go on, and we were left to figure out how to manage her condition. In fall of 2016, when Julia was about a year and a half, she started clobazam and zonisamide. In 2017, I actually counted them, she had 26 seizures, and she had 25 seizures in 2018. It helped, but it was still a lot. Then in December of 2018, we added DIACOMIT to her treatment plan, and we saw a real change. In 2019, she only had 8 seizures.
DIACOMIT is the only FDA-approved anti-seizure medication developed specifically to treat seizures associated with Dravet syndrome in children as young as 6 months, 15 pounds or more, and taking clobazam.
On DIACOMIT, her seizures were reduced substantially, from 25 to 8 in just 1 year. Since then, we've added other therapies to her plan, and we're trying to find the best combination for her. But we feel that DIACOMIT has made a significant difference for Julia.
There are also risks for use of DIACOMIT. The most common side effects are sleepiness, decreased appetite, agitation, impaired coordination, decreased weight, decreased muscle tone, nausea, tremor, slurred speech, and trouble speaking.
Julia is now 7 and has been on DIACOMIT for about 4 years. And with fewer seizures, Julia's been able to attend school regularly, and she's made some great friends. She has global delays, but she's in special education classes, and she gets all sorts of therapies. And with where we live, we're lucky to be able to give her equine therapy as well. With time and DIACOMIT, we've gotten much better at managing her seizures. We're so grateful that there's treatment specifically for Dravet syndrome available for children like Julia.
We hope that other parents and caregivers can find the treatment that works best for their child, and we hope they're finding ways to celebrate everyday wins. Even with her delays, Julia still has milestones. They're just different. We're so proud of her and everything that she continues to accomplish. Talk to your child's doctor about DIACOMIT, because for children with Dravet syndrome, seizure relief is possible.
Indication: DIACOMIT steripental is indicated for the treatment of seizures associated with Dravet syndrome in patients taking clobazam who are 6 months of age and older and weighing 7 kilograms or more. There are no clinical data to support the use of DIACOMIT as monotherapy in Dravet syndrome. Important safety information. Contraindications. No contraindications are listed. Warnings and precautions. Somnolence. DIACOMIT can cause somnolence. Monitor patients for somnolence, particularly when DIACOMIT is used concomitantly with other CNS depressants or clobazam, which is also known to cause somnolence. Decreased appetite and decreased weight. DIACOMIT can cause decreases in appetite and weight. The growth and weight of pediatric patients treated with DIACOMIT should be carefully monitored. Neutropenia and thrombocytopenia. DIACOMIT can cause significant declines in neutrophil and platelet counts. Hematologic testing should be obtained prior to starting treatment with DIACOMIT and then every 6 months. Withdrawal symptoms. As with most anti-epileptic drugs, or AEDs, DIACOMIT should be gradually withdrawn to minimize the risk of increased seizure frequency and status epilepticus. Risks in patients with phenylketonuria or PKU. DIACOMIT for oral suspension contains phenylalanine, which can be harmful to patients with PKU. Before prescribing DIACOMIT for oral suspension to a patient with PKU, consider the total daily intake of phenylalanine from all sources, including DIACOMIT for oral suspension. DIACOMIT capsules do not contain phenylalanine. Suicidal behavior and ideation. AEDs, including DIACOMIT, increase the risk of suicidal thoughts or behavior. Patients treated with any AED for any indication should be monitored for the emergence or worsening of depression, suicidal thoughts or behavior, and/or any unusual changes in mood or behavior. Adverse reactions. The most common adverse reactions that occurred in at least 10% of DIACOMIT-treated patients and more frequently than on placebo were somnolence, decreased appetite, agitation, ataxia, decreased weight, hypotonia, nausea, tremor, dysarthria, and insomnia. Pregnancy. There are no adequate data on the developmental risks associated with the use of DIACOMIT in pregnant women. Based on animal data, DIACOMIT may cause fetal harm. There is a pregnancy exposure registry that monitors pregnancy outcomes in women exposed to AEDs such as DIACOMIT during pregnancy. Physicians are advised to recommend that pregnant patients taking DIACOMIT enroll in the North American Anti-Epileptic Drug NAAED Pregnancy Registry. Information is available at www.aedpregnancyregistry.org. This can be done by calling the toll-free number 1-888-233-2334 and must be done by patients themselves or their caregiver. To report suspected adverse reactions, contact Biocodex at 1-866-330-3050 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see full DIACOMIT prescribing information at diacomit.com.